We're going to pick up now the second part of this lecture with disorders of pelvic support. The supportive structures in the pelvis area are muscles, ligaments, and the fascia. They tend to weaken with age, excessive stretching, obesity, or trauma. And in women, they obviously weaken during childbirth. Clinical manifestations, they're often asymptomatic, but sometimes you will have prolapse of the bladder, rectal, or vaginal areas. They can cause vaginal, urinary defecation, or sexual issues as well. Treatment involves Kegel exercises, avoiding straining. They also have vaginal pessary devices, which are vaginal rings that support the bladder. These must be removed and cleaned on a regular basis. And they may have incontinence intervention, which is bladder training or surgical options. The prolapsed organ severity grading system, you do not need to know, but the patient has to be in the dorsal lithotomy position to grade the support that the amount of pelvic support that they need. Abnormal uterine bleeding is menstrual bleeding in cycle frequency, blood loss, or flow duration. It's usually a sign of an underlying issue. There is new terminology for it. It's acute or chronic abnormal uterine bleeding, heavy menstrual bleeding, or intermittent menstrual bleeding, or amenorrhea. These is often caused by hormonal disorders, anatomic disorders, iatrogenic effect, which means we don't know, or there's environmental causes, or systemic disorders, or some combination of all of those. Amenorrhea is the absence of menstruation. It can be either primary or genetic. It can be genetic or atomic. Secondary amenorrhea may be normal for some people. There could be pathological causes, but the number one reason for amenorrhea in women of childbirthing age is pregnancy. So if somebody is telling you they're not getting their period, even if they've had negative pregnancy tests, you know, they're 100% sure they're not pregnant, always make sure you do those hormone levels to make sure they're not pregnant. Heavy and intermittent bleeding can be caused by structural disorders and non-structural disorders. During perimenopause, heavy and menstrual bleeding can be normal. Sometimes it's from polyps, fibroids, or malignancy. Abnormal bleeding during menopause, any bleeding after someone goes through menopause is cause for investigation. It could be because they're on hormone replacement therapy, but there also could be other things such as polyps, endometrial issues, malignancy, and iatrogenic causes. You'll note there is a nice list on page 356 to define those. Dysmenorrhea is painful menstruation. That it's either primary or secondary. Basically what happens though, there is an excessive prostaglandin secretion. That excessive prostaglandin secretion causes nausea, vomiting, diarrhea, headache, and dizziness. It can be treated with NSAIDs because what do NSAIDs do? They prohibit prostaglandin secretion, which is why people say they work so much better for menstrual pain and heat. Diagnosis can be made by history and physical exam, a pelvic ultrasound, and in severe cases, sometimes they do a laparoscopy just to look in and see kind of what's going on. The other treatment option is oral contraceptives. Perimenstrual syndrome, or PMS, it is the physical and emotional symptoms affecting women during the menstrual cycle. There are specific criteria, which you don't need to know. But know that it affects women in different ways and sometimes at different times. Some of the clinical manifestations include irritability, depression, mood swings, and fatigue. The exact cause of this is unknown. Diagnosis is made by history and physical. Treatment includes hormone therapy, diuretics, antidepressants, NSAIDs, lifestyle changes, and decrease in soda and caffeine. Endometriosis is a lesion growth or formation of the endometrium outside the uterus. There are several risk factors for it that include early menarche, heavy bleeding, a low body mass, late menopause, severe sexual or physical abuse in childhood or early adolescence. The manifestations depend on the severity, but women may also complain of dysmenorrhea, low back pain, bowel dysfunction, or any other treatments. Treatments include analgesia and hormone therapy, and in some cases, surgical therapy. Leiomyomas are a firm rubbery growth of the smooth muscle in the myometrium. They're the most common benign pelvic tumor in women. This is what you'd call fibroids. Risk factors include actually increased red meat, low vitamin D, alcohol abuse, and African American women are twice as more likely to have them than any other race. They're mostly asymptomatic, and most of the time we find them either when someone is trying to get pregnant and they're not being able to, or on a routine ultrasound, or as part of a workup for abdominal pain. The manifestations really include how you feel really depends on how big they are. You may find that you have some pain, and they may impact fertility and pregnancy. The diagnosis is made by history and physical. And a pelvic and transvaginal ultrasound. Treatment, again, mostly it is not required, but again, it depends on the pain and it depends on the level of pain the patient's having and if it's interfering with pregnancy or trying to get pregnant. So treatment can include just monitoring them, hormone therapy, or surgery. Ovarian cysts are benign fluid-filled sacs on the ovary. They can be either follicular or corpus luteum cyst, or they can be functional or dermoid cyst. Clinical manifestations also include abdominal pain or discomfort, abnormal menstrual bleeding, or abdominal distension. Women can often complain of a lot of pain with an ovarian cyst, especially when it bursts. They can be very, very painful, and sometimes they even have to be hospitalized for 24 hours just for pain control. But pain is, diagnosis is made by history and physical, ultrasound, and to make sure that, that they look normal and there's not a tumor and just that they're fluid filled. They're often self-limiting and self-resolve. If treatment is needed, sometimes you can use oral contraceptives, or surgery may be needed with an ovarian cystectomy. Next, we're going to talk about polycystic ovary syndrome. It's the most common endocrine disorder. Over 5 million women of reproductive age have it. They are characterized by how they lead to menstrual and ovarian dysfunction. The etiology is largely unknown. However, there are risk factors and disorders that can make women more prone to them. The clinical manifestations you see are often a result of the excess androgens. So women may have abnormal face and body hair, acne, male pattern baldness, infrequent menses, anovulation, obesity, and ovarian cyst. The diagnosis is made by history and physical and checking hormone levels. Women are at increased risk when they have obesity, insulin resistance, diabetes, dyslipidemia, and they're also at increased risk for endometrial and breast cancer. Treatment includes weight loss, hormone therapy, and oral contraceptives. Treatment is basically based on the symptoms. It can present infertility issues, so diagnosis of the polycystic ovary syndrome can be important, and based on the woman's goal, if they're trying to achieve pregnancy, a fertility specialist could help them with that. Benign breast mass are often non-proliferative, which means they don't grow, or they're proliferative without aplasia, which means they don't change. They may have atypical hyperplasia. Breast masses are very common. They often increase in size or pain before or after menstruation. The diagnosis is made by ultrasound, and treatment is largely based on symptoms. Mastitis is an infection of the breast that can be associated with infection and or lactation. Women often notice that they have breast lumps, pain when breastfeeding, flu-like symptoms, nipple discharge, and large axillary lymph nodes, typically on the side where the infection is, and the breast often looks very red and painful. Treatment includes history and diagnosis and culture. They may do an ultrasound of the breast as well to make sure there's no collections there. Treatment includes antibiotic therapy based on whatever bacteria you think it might be, adequate hydration, rest, analgesics, and a supportive bra. It is still okay to breastfeed during mastitis as long as the antibiotic is appropriate for breastfeeding moms. The other old kind of wise tale is when someone has mastitis is to put the cold cabbage leaves on your breast, but many women swear it works. So whatever works to keep you more comfortable. Prostatitis is an infection of the prostate. It can be caused by bacteria, sperm, trauma, stress, or urinary catheter. The most frequent cause of prostatitis is our old friend E. coli. Clinical manifestations include dysuria, difficulty urinating, nocturia, painful ejaculations, recurrent UTIs, and they may also, depending on the level of the prostatitis, have systemic symptoms such as fevers, chills, or rigors. Diagnosis is made by history and physical, and a urinalysis with gram stain and culture, because again, the culture will be important to determine the kind of antibiotic they need to be on. The treatment is long-term antibiotics. It's not just going to be your, 5 to 7 days. Sometimes they need 14 to 28 days of the antibiotics, analgesics, antipyretics, hydration, and sitz baths. And frequently, I've seen urology use saw palmetto as in men who are prone to prostatitis to help prevent it. Epididymitis is inflammation of the epididymis. It is usually caused by bacteria or STDs. Here are most common bacteria are, again, our friend E. coli and Pseudomonas. Risk factors include not being circumcised, recent GU surgery, urinary catheterization, and sex with multiple partners without using a condom. Clinical manifestations include, again, those systemic effects like fevers, chills, nausea. There can be testicular tenderness or friend sign, which is increasing the scrotum relieves the pain, or penile discharge. Treatments include antibiotic therapy, analgesics, bed rest, scrotal support, and testing all partners, sexual partners, for STDs within the last 60 days. Candidiasis is a yeast infection. This is most commonly occurs in women around the vaginal and vulva areas. It can happen in men as well, but less common. Manifestations in women include a white, thick vaginal discharge, vulvular erythema and edema, or vaginal and labial pruritus, or all the above. Clinical manifestations in men, again, include that white curd-like discharge, pruritus, and erythema, or small white patches on the penis and foreskin. Diagnosis can be made in the office. Sometimes you can look under a microscope. Sometimes you can tell by looking at it. If you're not sure by looking at it, you should always culture it. Treatments include antifungal agents, peritoneal care, and prevention strategies. Patients should seek provider evaluation for these things, as it could be a more complicated infection if it becomes reoccurrent. STDs are sexually transmitted infections. There's a broad range of infections, and there is mandated reporting by the CDC of chlamydia, gonorrhea, and syphilis. There are varying prevalence according to the geographic region, and overall STDs have been on the increase in the United States. And the number one way we know to prevent STDs is either through abstinence or condom use and limiting sexual partners. Chlamydia is caused by Chlamydia trachomatis. It is the most frequent STI in the United States. It is usually asymptomatic, but when it is present, you will notice that there's a purulent cervical discharge. And if you're looking at a woman's cervix, you'll see that it's very friable, which means that it tends to bleed easily. In a woman, there may be post-coital bleeding, dysuria, painful intercourse, or rectal pain. Clinical, complications include pelvic inflammatory disease, infertility, and chronic pelvic pain. Diagnosis is made by the NAAT. That's basically a test to see if it's chlamydia or a culture. And all pregnant women should be screened, because if someone does have an active chlamydia infection and they give birth through the vaginal canal, they need to treat that chlamydia before the fetus or the baby comes through the canal, because they can actually get chlamydia in their eyes that is transmitted through the vaginal canal. So that's really important to make sure you check pregnant women for that if it's not done by their OB provider. Treatment is antibiotic therapy. Gonorrhea attaches to the epithelial mucosa of the vagina, mouth, or anus. It is a sexually transmitted disease, but it can also be treated transmitted mother to child, again through childbirth. It is often asymptomatic. The manifestations are similar to that of chlamydia. Screening is also done on all pregnant women because of that. And again, it's done through diagnostic treatment. Antibiotics include ceftriaxone or azithromycin. Ceftriaxone is Rocephin, and azithromycin is the Z-Pak, although it's in different doses than the Z-Pak. There is varying resistance to some of those antibiotics for gonorrhea, so it's important to know which antibiotics are working in your neighborhood, and you can get an antibiotic gram from your local lab, which is basically where they test all the different kinds of bacteria and all the different antibiotics that work, because they can vary by region. Part of the treatment also includes screening and testing of all sexual partners within the last 60 days. BV, or vaginal venosus, is a common cause for vaginal discharge. It's a reduction in the vaginal flora and an increase in other type of bacteria. It is usually asymptomatic, and women notice it because they may have a increased vaginal discharge. Again, it's made by culture and treated with antibiotics. Pelvic inflammatory disease is an acute infection of the female reproductive system. It's a result of an STI ascending to the upper genital tract. It often includes fever, pain, tenderness in the pelvis, lower abdomen, or back. Women may notice dysmenorrhea or abdominal discharge. Treatment is to cover with broad spectrum antibiotics and do cultures, so you can stream in your antibiotic therapy. Syphilis is an ulcerative infection. Again, the different modes of transmission. It's a sexually transmitted disease. The diagnosis is again made by history and physical and serological testing. It's treated with penicillin, doxycycline, or tetracycline. An interesting fact about syphilis, and as we're talking about all the STIs, remember that older folks, those over 65 are now living in retirement communities, and single people are often getting together more and more, and they are less likely actually to use condoms. So remember not to forget people over 65 when you're screening for STDs, if you think they're at risk for that. Syphilis untreated can also be one of the causes of mental status changes in older folks that has been undiagnosed. So if you get one of those people, somebody that you just can't figure out why they're having mental status changes and it's kind of sudden, you can always check them for syphilis, because that can cause mental status changes as well. Genital herpes is an infection that causes blister on the genitals and in the reproductive tract. It's characterized by, sorry about that. Our recurrent episodes of lesions, there can be type 1 versus type 2, which is the genital herpes must also be treated during pregnancy, because again, the mother can transmit genital herpes to the baby through the vaginal canal. So that they must be actively treated while they're pregnant. Primary herpes genitalia includes multiple painful vesicle lesions. There's a period of herpes genitalis antibody formation. Treatment, we'll go through the recurrent herpes vaginalis. It's reactivation of the blister and the virus at the same time. There can be triggering factors. Diagnosis is made through observing history and physical, and you want to check a viral culture of the vesical fluid. Treatment includes stress reduction, avoiding sexual activity during outbreaks, and prevention. There are medications that you can also use to prevent. They do actually use some medicines now to prevent the herpes transmission if someone is in like a committed relationship and they don't want to have, they don't want to use condoms, but you can also treat the genital herpes during an outbreak, but you have to avoid sexual activity during that time. Remember, until those blisters are healed up and there's no more fluid coming through them, you're still contagious. This, I'm going to kill this one. Condylomata is a benign growth caused by HPV. It is characteristic. There can be growths in the vagina. It often causes abnormal bleeding, discharge, and itching. Treatment includes, remember, we have the vaccine now for HPV, and they can also have surgery to remove it once the areas are large enough. Trichomonas is caused by the Trichomonas vagitalis bacteria. It usually coexists with other STIs. Women are usually asymptomatic, but if they do have clinical manifestations, they often have a copious, odorous, frothy, thin vaginal discharge. They may have small petechiae, itching, painful intercourse, or dysuria. It is often a complication during pregnancy, and again, can be transmitted to the baby through vaginal delivery. Again, you'll check it under the microscope and send serological testing, and treatment is with metronidazole or Flagyl. To conclude this, the reproductive system, we're going to talk a little bit about the cancers associated with the reproductive system. Once I can find. All right, the first cancer we're going to talk about is penile cancer. It's a rare malignancy. I can say that I've never actually seen a case of this, but it can be out there. It most commonly is caused by squamous cell carcinoma. And typically there's good prognosis with early diagnosis and treatment. It may require a penectomy if the cancer is extensive. But again, it's not a cancer you're going to see very frequently. Prostate cancer is very common. It's the most common cancer among men. It just tends to happen to men as they get older. And I'll be honest, the prognosis depends on when they get it. If you have a young man who is diagnosed with prostate cancer, you will probably treat that with a radical prostatectomy, radiation, or anti-testosterone therapies. And the way you measure it, the way you treat it is through measuring, the diagnosis is made through PSA measurement. So all men get a PSA check once a year after the age of 40. But so if it's someone young, you'll probably be more aggressive. If it's someone who is older, prostate cancer is often very slow growing. And if there's someone older, depending again on the person, what their lifestyle is like, how active they are, you may not even treat the prostate cancer because something else, because it's it grows so slow, something else may kill them before prostate cancer does. Prostate cancer is common to spread to the bone. So a lot of people, their first, after they're diagnosed with prostate cancer, one of the things that happens is they get, over time, metastasis to the bones. So it all really depends on when the male is diagnosed. Testicular cancer often occurs in younger men. It is often asymptomatic, and the clinical manifestations include a hard, painless, palpable mass, testicular discomfort, testicular enlargement, or gynecomastia. Remember, men, when they get enlarged breasts, that is typically not normal for them. And remember that men can get breast cancer too, and this is also, testicular cancer is one of the risk factors for that. It's very curable. It often happens in men in their 20 to 40 range. These men need an orchidectomy with chemotherapy and radiation. Breast cancer is the most common malignancy in women. Risk factors include a genetic history, obesity, poor diet, inactive lifestyle. Family history is one of the most common. There is a genetic predisposition as well. There are two types, either infiltrating ductal carcinoma or infiltrating lobular carcinoma. Classically, a woman may feel a dominant, hard, immovable mass with irregular borders. So again, when you're feeling kind of nodules anywhere, whether it's the breast or the lymph nodes, nodules that don't move tend to be more concerning than nodules that move. So this mass is going to feel hard. It's not going to move. Things that don't move tend to be attached to muscle, and that's more concerning for some type of cancer. You may notice on the breast there is erythema, dimpling, or a pucking of the skin. And to assess for that in a woman you might be concerned about, you want to have them lean forward and see if you see any puckering. There can be metastasis. Again, screening recommendations include over the age of 40, women get mammograms once a year. Earlier, if there's a family history. The treatment is usually aggressive and multimodal. It depends on when it's diagnosed, exactly what's going to happen, but it's much more curable than it was. And remember, the gene is the BRCA2, 1 and 2 gene that is associated with breast cancer. Cervical cancer overall is declining because we now know that 99.7% are caused by HPV infections, and we now have vaccines to prevent HPV. The procedures, generally this is why we do PAPs on women every year. If they have abnormal cells, you'll see them. There are procedures done to remove the precancerous cells. In early stages, the women might notice vaginal bleeding or acute onset of uterine bleeding. Uterine cancer in its advanced stages can be seen as weight loss, anorexia, fatigue, pelvic, back, or leg pain, unilateral leg extremities. They tend to look very ill and very sick. The biggest way to improve your treatment improve your risk for this is to have the HPV vaccine and have your PAP every year. Precancerous lesions or early malignancies can be removed with laser therapy or cryptotherapy, or through an exploratory lab. Advanced cancer includes surgery, chemotherapy, and radiation. Malignant endometrial and uterine tumors. Cancers of the uterus are mostly endometrioid. They are unopposed estrogen. That means there's an excessive estrogen. The most common symptom is painless abnormal bleeding, especially in women who, again, are past menopause. The diagnosis can be made. Endometrial biopsy is the gold standard. You may also have treatment, do a vaginal ultrasound and testing of hormone levels. Treatment, again, depends on when it's diagnosed. Early treatment includes chemotherapy, radiation, hysterectomy, and hormone therapy. Ovarian cancer is the 5th leading cause of death in women. The hard thing is that there's no reliable tests, and people generally don't know they have it. It's very difficult to treat, and by the time women get diagnosed, it is often metastasized. It's mostly in the form of epithelial cells. Risk factors include genetic predispositions, advancing age, infertility or nulla grava, excessive estrogen exposure, obesity, and androgen hormone therapy. Common symptoms include abdominal distension, pelvic or abdominal pain, eating disturbances, urinary frequency, or urgency. Again, diagnosis is made through history and physical. You want to check, this is a lab value, a CA-125. You may also have imaging studies or biopsy. So again, a woman is not necessarily going to have any symptoms of this, but if someone comes in with kind of weird complaints in their pelvic area, it never hurts. You don't know exactly what it is to get a pelvic ultrasound, because a simple ultrasound can identify some of these abnormalities very early, and that makes it more likely that you'll be able to recover and treat them. Preferred treatment for ovarian cancer is surgery and chemotherapy. This concludes the lecture on reproductive disorders. I hope you'd enjoyed it. And if you have any questions, please don't hesitate to ask.